Welcome to my word once more. The word of knowledge acquisition. As Akinola-Anjou. Today, I must recognize the important role the pathologist plays in helping to discover the cause of death. And I must also recognize the important role medical laboratory scientists play in helping us to stay alive. I also doff my hat to all the medical professionals, all health professionals that are involved in keeping you alive, because all the effort of the health team is towards having people who will survive for a long time, as long as their health, their body systems can take it. I must also thank you that you are watching for all your efforts in acquiring knowledge and staying alive. Today's topic, you might be wondering, why alive? It is about sudden death, and the topic is titled, How to Prevent Sudden Death. I have sectioned it to parts when we watch the slide, starting with the definitions, the WHO definition, the cause. What are the causes of sudden death? The risk factors. What are those things that are risky that we should try and avoid doing, because they surely predispose us to sudden death, and the prevention itself, the prevention and control. That's the last part of it. I am not dwelling on treatment because the topic is all about how to prevent sudden death. So let's move on to the slide section. Yes. How to prevent sudden death. The definition, WHO definition goes thus: sudden death, according to the International Classification of Diseases, version 10, is death not violent and not otherwise explained, occurring less than 24 hours from the onset of symptoms. This is very clear that you do not classify people who die by accident, flood, bombing, explosion, all kinds of violence. Within 24 hours that you did not see them, there must be that onset of symptom for you to classify it as sudden death. Then the next is the classification of sudden cardiac death. The sudden cardiac death is now something else that happens within 1 hour, even less than 1 hour of the onset of the symptom. In this area, you have coronary artery disease as the most common cause of sudden death, accounting for up to 80% of all cases. When you are talking of this sudden cardiac death, you are thinking in line with ventricular fibrillation, that is the mechanism of sudden death. You have where you can even do sudden test, which I shall come into, and the cause have now been proven to be some of them to be genetical. We can also talk of the thrombosis, the embolisms, and all the clots that usually result in that. There is also the sudden infant death syndrome, that is acronym SIDS. Is the unexplained death, usually during sleep. I will remember that of Solomon's wisdom, of a seemingly healthy baby less than a year old. It usually happens like that. But what are the causes of sudden infant deaths? We can think strictly of birth defects. We can also put preterm, that is premature deaths, birth weight. They are so tiny, the weight is not up to the expectation. And we can also talk of injuries and maternal pregnancy complications. But the sudden infant death syndrome could be likely to also many unexplained deaths that you see in children and in babies. And once this happen, I believe that if a child survives sudden infant death, it could live up to 70 years or more. These are where you now face sudden cardiac death. Going further, sudden death screening is a test which is performed to examine the electrical activity of the heart and understand the potential. The causes are the latest clinical study published in 2020 demonstrated that generic alteration in the glycerol 3-phosphate dehydrogenase 1-like gene led to decreased activation of the sodium channel and consequently early repolarization syndrome, one of the causes of sudden cardiac death. So you can see progress has made. Experimentation on risk factor. It has been done that vulnerability to sunny that was produced in laboratory rat that was isolated, that it probably you can this is transferable because there are so many tests that has now probably aligned with this, that when people live in isolation, living alone, they really die. Animals who were group house did not die even when they had been previously handled. So when you compare living alone, especially those who are retired, when they live alone, they are prone to sudden death because of so many factors. But when they live together, people are always there, and they are not living a kind of sedentary life. They are exercising themselves, and so you can imagine that such a life is full of so many activities. Even some in our locality have their grandchildren, their children. Very worrisome thing. That is, they run around, and by the time you are doing all these little play with the children, you are living according to what will make you survive well. Risk factors predisposing to sudden death includes age and sedentary life, which I just mentioned. That if we do exercises and lifestyle, we are prone to help the aging process, so that we do not age very well. We eat vegetables and fiber fruit, vitamins that will more or less antioxidants. Congenital heart disease is also part of the risk factor. Thyroid issues, both hypothyroidism and hyperthyroidism, are part of the risk factor that we must monitor. High blood pressure is one. Diabetes control is very necessary. When you control both your high blood pressure and your your sugar level, you are helping to reduce the risk factor, the speed at which one could die from sudden death. Caffeine control and nicotine is also there. Both of these can heighten heartbeats and exacerbate an already existing arrhythmia problem by making the heartbeat faster. And when the heart beat faster, the heart cannot cope. You can imagine an aging heart will suddenly go through the mechanisms of ventricular fibrillation of sudden death. Alcohol. Drinking alcohol too much can disrupt the heart electrical rhythm, causing an arrhythmia to develop. And like we said, the age is a factor. So when you are drinking easily, so many bottles when you're young, but as you grow old, please take control. Illegal drugs, cocaine, are also indicated. Electrolyte imbalance. Electrolyte imbalance can be caused by dehydration, sweating, vomiting, and diarrhea. So when you have all these, especially when you sleep at night and a very hot place, you could be dehydrated. In severe cases, this imbalance can cause heart arrhythmia. Yes, that's true. Smoking too causes inflammation of the vessels. So we must take care of our blood vessels so that they may not predispose us to sudden death, because they could cause atherosclerosis and clot embolisms. Drug abuse, whether you undertake or use drugs, these are also things that could cause heart arrhythmia, and you can understand what it leads to finally, sudden death. So controls are very necessary in our life to about these risk factors if we want to live above or die peacefully and not what is categorized as sudden death. The prevention, which is the area of real test, we have mentioned a sudden death test. This is also using the ECG or EKG, electrocardiography or gram. I know insurance companies usually use this to even safeguard their amount the person will pay, the premium, so that if they can see a derangement of sort as regards the wave which we had highlighted, the wave that could affect and cause ventricular fibrillation, which is the mechanisms of sudden death, they quickly would increase the premium and make sure. So it's a physiological test that has helped so much to really save lives. Cardiac enzyme test is a laboratory test that indicates ischemia and myocardial infarction, and these are not commonly high. Once they are seen high level, it only shows the level, the destruction that has taken place as regards the heart. So the heart is no longer as efficient as before because of all these enzymes that are now being leaked out, which is as a result of damages or infarction, that is, blood supply are not getting there. Electrolyte, calcium and magnesium, as earlier mentioned, as blood coagulation test is also very useful, so that the coronary artery will not be blocked and then cause sudden death. Hypothyroidism, tachycardia, and bradycardia for hypothyroidism will also predispose one to this reading that could start the mechanism, ventricular fibrillation mechanism of sudden death. It has also been discovered that brain BNP has predictive value, especially for myocardial infarction patients. It provides prognostic information on the risk of sudden cardiac death. So doing this kind of test and controlling it so that you remain within the normal value will also help. Inflammation and infection markers, the ESR, electrolyte sedimentation rate, and C-reactive protein, especially within those with myocarditis, will be very instructive to control. Early access, these are defibrillators where you save the life of somebody by within that 1 hour of a symptom. The life could be resuscitated using cardiopulmonary resuscitation method. Then the other tests include blood pressure tests, which is very commonly done. That is, you want to fall within the normal range of less than 140/90. That is, the systolic is less than 140 diastolic of 90. There is also the A-dimer test, which is used to find out if you have a blood clotting disorder. This disorder includes deep vein thrombosis. When you're talking of thrombosis, you are talking of blood clots. And when there is a blood clot, blood is not supplied to the heart. And when the heart cannot pump, you can understand that the mechanism of sudden death would, the process will be on. That is, the ventricular fibrillation mechanism of sudden death will take place, and the person will be reported dead. So a blood clot that is deep inside the vein, usually we do not see, and lipid profile tests are all has to do with derangement in values that could predispose one to sudden cardiac death. So we must take control of all these tests. Once we have a derangement, we have a value that is too high, predisposing us to sudden cardiac death, we now do the needful by changing our lifestyle and also doing the recommendation of your medical personnel that should subscribe and subscribe.